Let's begin by talking about quadrant number 2. This is the cognitive fusion quadrant. This is one of the most dynamic concepts in ACT therapy. However, it can become very confusing and oftentimes complex for both the clients and the clinicians to understand what is occurring here and how do you begin to cope with some of the processes that are happening. In this next portion, I'll begin to explain what is cognitive fusion and what are some of the processes and skills that are important to understand within this quadrant. You're going to want to begin by describing the word or the term cognitive fusion. Now, the word fusion can be oftentimes confusing or misunderstood by clients. So this is where you're going to take time to define what fusion is in terms of maybe common language the client might use. Some words that I use to describe fusion might be being stuck to, caught up in, tangled up with, fighting or battling, or hooked by thoughts and emotions. It can also be helpful to give a fun little analogy of what fusion is by describing something like having a sucker in your hand that you've accidentally set down or dropped to the floor, and before you know it, whatever it landed on, it's now stuck to. This is somewhat happens in the mind when we have certain thoughts and emotions. Very quickly, our mind can get stuck to those certain words and phrases and feelings. Another analogy might be wrapping a gift for someone, and you take the tape off of the roll that you're about to wrap the present, and you realize the tape has got stuck to the end of your finger or accidentally sticks to the edge of the wrapping paper, and before you know it, you're in a fight to undo the tape or get it unstuck from your finger or unstuck from the wrapping paper. This can be very frustrating, and many of us can relate to that analogy. One final analogy that works very well with adolescents and even with adults is the concept or the phrase of being hooked by. This can be explained by a fishing hook being dropped in a lake and a fish being hooked by the bait on the end of the hook. This is somewhat similar to our mind as a thought or a particular emotion is felt or experienced, and we become hooked by that thought or emotion, similar to a fish biting on to the end of a hook to get the bait. It's important at this point to make sure that they understand the concept of cognitive fusion, because this concept is so prevalent throughout the remainder of the ACT matrix as well as ACT therapy in general. Again, this is a very dynamic concept that the word is going to need to be referred to quite a bit. So process the word fusion with the client and have them come up with or identify some analogies as well as some phrases that work well for them, such as being stuck to or being hooked by. This can be very helpful as you begin to discuss these terms and this concept with them regarding their thoughts and emotions. Now that you've discussed fusion, you're going to move on to the first activity in quadrant number 2. This is where you're going to work with the client to identify thoughts and emotions that they find unwanted, difficult, challenging, disturbing, negative, unhealthy, scary, sad, angry, etc. It can be helpful to do this next activity in a very orderly way by starting with their primary or chief complaint that they've sought counseling for. For example, if they've come in primarily for anxiety or stress, begin to identify the thoughts and emotions that they find unwanted, difficult, challenging, etc., that have to do with their anxiety or stress. Then move on to their next symptoms. For example, if they also show signs of depression, move on to identifying thoughts and emotions that they struggle with regarding their depressed mood. The list might look something like the following. The client might identify a phrase such as, "I'm worried about what others think about me. I'm not going to do well on this assignment. What if I fail? I'm so worried. I'm stressed. I'm anxious about." Don't worry about making an exhaustive list. About this many items should be plenty to be able to process this quadrant with the client. As I said previously, you can also then move on to their other symptoms such as depression and do a similar list. As a frame of reference for you as a clinician, the reason you are doing this type of identification in quadrant number 2 is that you're actually setting up the basic argument for CBT, which is that an individual's thoughts and feelings will eventually connect to and drive their behaviors. Quadrant number 2 is processing and making a list then of their thoughts and emotions, which will eventually be connected to quadrant number 3. Now that you've created a list or two about the thoughts and emotions that they find challenging and difficult or get stuck to or hooked by, you're going to now use this list of thoughts and emotions to then proceed to a discussion moving to quadrant number 3 regarding the behaviors they begin to take in order to attempt to get rid of those thoughts or emotions or deal with those thoughts and emotions. I'm not going to be going into the particular skills or concepts that can be used to deal with cognitive fusion in this video. I'm going to continue on to quadrant number 3 as I'm using this particular video series to discuss how the ACT matrix is used to assess or evaluate the unhealthy patterns or the avoidance patterns that clients have fallen into over the years and that contribute to their current symptoms. In future videos, I will return to discuss the specific concepts, tools, skills, techniques that clients can begin to use in each of these quadrants to begin to cope with and manage these particular areas. Let's go ahead now and move on to quadrant number 3.